This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're in the intensive care unit, the ICU. Now this is where you would be brought if you were suffering from a stroke. That's the subject of today's Focus on Health. We're going to be talking with Brianna Klotz, who's a nurse and also the stroke program coordinator. Well, thanks for taking some time with us today. We're talking about stroke, so let's start with the basics. What is a stroke?
A stroke is a brain attack when your brain doesn't get the oxygen that it needs from adequate blood flow, whether it's a blockage in one of the arteries or maybe a burst vessel where there's bleeding in the brain. It's pretty much brain damage that results from inadequate blood flow.
A lot of times we hear heart attack, stroke kind of put together. Is it kind of the same as a heart attack except with the brain?
That's a good way of thinking about it, yeah.
Okay. Are there different types of strokes?
There are different types of stroke. The most common, being 87% of all strokes, are what we call ischemic stroke, and that is the kind of stroke where there's a blockage in the blood flow.
Now, I would imagine time is of the essence. We always hear the term FAST, F-A-S-T. What does that mean, and how important is timing when you think somebody's having a stroke?
So treatment for stroke is available, but it's very time sensitive. So it's very important to recognize and remember the symptoms of a stroke, and we do use the acronym FAST. So F stands for facial droop, A stands for arm weakness or arm drift, so you would have someone hold both arms out, and if one is weak or they can't lift one arm up. S stands for speech, so that could either be slurred speech, garbled speech, or maybe they're just getting the wrong words out, so ask them to repeat a simple sentence or ask them a simple question. And then T actually stands for time to call 911.
Okay, so let's go through a scenario. If I think you're having a stroke right now, what's the best thing to do?
To call 911.
Okay. Don't try to drive.
Don't try to drive. Each situation can be unique. You need to get to the emergency room as soon as possible. Patients who call 911 have better outcomes because there's a whole system set up. We personally have a very close relationship with Oshkosh Fire Department. They let us know ahead of time when a stroke patient is on the way in. The ER staff is ready. Oftentimes the patient will come right off of the ambulance and go right straight to the CT scanner, or the CAT scan, which is our standard of care nationwide for stroke patients. We want to make sure that there's not a bleed so we can proceed with other treatment.
Okay.
So
the facility that you have here at Aurora in Oshkosh, outstanding facility, and you're also a certified stroke center, is that correct?
Correct. Yep, the hospital is certified by the Joint Commission as a primary stroke center.
And what does that mean?
So what a stroke center means is that we're committed to providing the best care that we can to our stroke patients, that we record, measure, aim for achieving certain outcomes that are nationwide standards, that we want to be the best and at the top and provide for the best outcomes for stroke patients when they come here.
Sure, and you have dedicated staff here to stroke patients as well, correct?
Yeah, in this hospital, our stroke center or stroke unit is in our ICU, but that doesn't mean that all stroke patients are so sick that they're in the ICU. It's just a smaller group of nurses and staff that maintain the competencies to care for stroke patients.
Okay, so I'm going to take you through another scenario here. If a person is experiencing a stroke and they call 911 and they get to the hospital, kind of take us through what happens when a patient arrives here at Aurora.
So things will happen really fast. There's a lot that happens at the same time. The first thing that will happen is that we want to get that patient to the CAT scan or CT scanner, and the purpose of that is that we want to make sure that there's not any bleeding going on in the brain. If there is bleeding going on in the brain, then we kind of switch gears and get that patient to where they need to be taken care of by a neurosurgeon, because we don't do that here. That would be Baycare or St. Luke's or Theta Clarkinina. If there isn't any bleeding in the brain and we're pretty sure that this is a stroke, then the standard of care is the clot buster medication, TPA, otherwise known as Alteplase. but that is we're only able to give that within a small amount of time. It's approved for most patients within 3 hours of the symptoms starting, otherwise 4.5 after that. So we have a pretty narrow window of giving that. So they go into the CAT scanner and we do an assessment. The nurse will assess their symptoms. The physician will also look at their history to make sure that they're not on anything that would interact in a bad way with the clotbuster medication to make sure that they can receive that.
So there is a lot going on as soon as you get to the hospital. And again, time is so critical to get to the hospital if you think you're having a stroke. I suppose the best way to avoid all this is to avoid having a stroke. What are some of the things we can do to help prevent a stroke?
Well, like everything else, you compare having a stroke to having a heart attack, and it is all in our cardiovascular system. So really a lot of the same risk factors. One of the biggest ones, though, is high blood pressure. And I think that, that unless you get it checked, you don't know that you have it. So maintaining a good blood pressure, healthy food, diet, exercise, not smoking, managing your stress, all of that stuff, and we've heard it all before, but it's true.
Right. We all know how to be healthy. It's just a matter of getting it done, and obviously you want to avoid a stroke and other health problems. Brandon, we appreciate you taking some time with us today.
Thanks.
So remember, when it comes to stroke, time is of the essence. You need to get a hold of 911 as soon as possible. Now, if you just have some general questions about stroke and how to prevent a stroke, you can always get a hold of your primary care provider or give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.